Okay, for the sake of time, I think we're going to go ahead and start. I'm pretty sure that we'll get more people joining as we go, but we do want to honor our time here. So I'm Walter Proper, and the Executive Director for IPHL, and we have a great panel today about outsourcing transport of health commodities. I think it's a very interesting topic, something that I personally have worked on myself in my 30-something years of doing supply chain. Our panelists first started with Scott Dubin, who is a supply chain and private sector engagement advisor at the Global Fund, also a former colleague of mine. He has 20 years of experience designing, implementing, and managing projects in different environments in the US and abroad. We are also joined by Alvaro Lopez, who is an outsourced logistics expert, team lead at VillageReach, is also someone who is supporting the development or the redevelopment of the IPHL chapter in Mozambique. He also has 20 years of experience in the supply chain field, working both in private and public sectors. And he's developed supply chain solutions to support the Ministry of Health in Mozambique, really to look at reaching the last mile, which is so critical. And then we're joined also by Esselina Brito. She's an outsourced transport advisor at VillageReach and also based in Mozambique. She's a pharmacist by training with 12 years of experience working with governments to really make sure the availability of products and commodities at the last mile. So I'm going to go ahead and turn this over to Scott to begin. Oh, before I do that, yes, we will be, if you have questions, please put them in the Q&A function. And we will try to answer all of them during at the end of this panel presentation. And if not, we would certainly follow up and address them at some time, but all questions will be addressed. So thanks. So without further ado, I'll turn it over to Scott.
Yes, thanks, Walter. Hi, everybody. Nice to join you and my colleagues from VillageReach. It's good to be together. And thanks to IPHL for hosting. This is a great topic to discuss. So I will cover just a little bit of intro for what outsourcing logistics is to set up my colleagues from VillageReach to talk about their work. So first, we'll just cover what logistics outsourcing is. And I think a lot of people would be most familiar with the work done around warehousing and transportation distribution for outsourcing to private providers. And so logistics outsourcing, we say, is when you are contracting with an external entity from your organization to provide that logistics service. So when you do it in your organization, we call it insourcing. And when you seek it externally, it is outsourcing. And there's a variety of terms that are used for that. Contracting is one that's replaced with outsourcing, but I tend to like the term outsourcing more. I think it covers more of the areas that are involved in all the steps of outsourcing besides just the contracting aspect of it. And so what we've seen is typically warehousing and distribution is outsourced as what we call, as well as 4PL services. So somebody managing your warehouse and transport providers on your behalf. And just some other areas that can be outsourced as well, just to list a few on the screen, are such things as customs clearance and freight forwarding, reverse logistics, kitting, IT services, data collection, order management. So there's a variety of things that can be outsourced. But again, really the top three that we see are the three ones initially listed on this slide. Next slide, please. So we ask why outsource, and really there's not one answer for outsourcing, and really it would be based on your needs as an organization. And here we have listed a variety of needs. Obviously there's big ones like improving performance. If we think outsourcing will provide better performance, that is usually a significant reason to do that. Sometimes it will decrease cost, but again, not always. I mean, sometimes you're paying for better performance, but we often see a need around reducing the capital investments that are required for building and maintaining warehouses and fleets and so on. And so that expense is high, and often it can be reduced, obviously, through using outsourcing where you're not required to purchase or maintain these types of assets. Flexibility and scalability is a big one as well. As your needs fluctuate, whether up or down, if you have your own assets, your own operation, it's very difficult to scale. But when you are outsourcing, you can add on services, require additional warehouse space or additional trucks, and scale back when needed as well. And some other reasons that are really important is around technology, because technology is obviously a very expensive investment for an organization. And when you are spending money on that technology for just your operations, you might not get such good economies of scale, because there's often a lot of development costs and tailoring costs that go into the acquisition of technology. And so often we find outsourcing providers have made these investments, and so you can tap into their technologies such as electronic proof of delivery or tracking or inventory management systems and transport management systems. And one thing to always think about is really, what is the core competency of your organization or of an organization? Is logistics a core competency? And so we often see that, well, once that decision is made, realization rather, that it's not a core competency, it can be very beneficial to outsource to an organization whose core competency is indeed logistics. Next slide, please. So how are we currently using outsourcing? What we see a lot is donors are certainly funding a large amount of outsourcing, and this is to support efforts of governments to support certain aspects of their supply chain. And sometimes this is seen when there is an emergency and all of a sudden there's a need to scale up. Outsourcing might occur, donors might come in and pay for additional warehousing or transportation. And this is, I would say, really the bulk of outsourcing that we see is done typically by donors, paid for by donors and managed by implementers, and at times in conjunction with governments. It's not always a complete parallel system. And then we see governments often more on the transport side than on the warehousing side in terms of using outsourcing. And those logistics providers can offer services for managed warehouse services, but what we see happen with governments is more typically they are using renting space from warehouses and non-managed warehouses. So just using kind of the building and perhaps even racking, but not the staffing will remain with the government. And when the government is using transport outsourcing, it's typically supplementary to their existing fleet. But we have started to see a larger interest from governments to begin outsourcing and identify which aspects of outsourcing. It's not an either or. It's not as if they are going to outsource everything, but which aspects, which ones are really more of their core competency than others. And so some of the challenges that we have, I would say, in regards to outsourcing is really a common understanding, even just with terminology, but having processes and standards which are kind of shared and universal across the industry. Ours specifically in kind of public health or relief and development, there really isn't a consistent standard which we would point to. We haven't really collected large amounts of data by which we could benchmark. And we have, even though there's 4PL services provided, it is really in its infancy in our environment, and we don't have, I would say, a good variety and well-experienced companies who have provided what we would look at or we would define as 4PL services. We often see support with logistics, but not as we would expect in terms of the expectations of a 4PL for having standard processes and technologies to manage logistics providers on your behalf. Next slide, please. Yeah. So at this point, I'm going to hand it over to Alvaro, and at the end we will take questions. But thank you very much for your time. Over to you, Alvaro.
Thank you so much, Scott, and thank you all the participants to be part of this. We are very happy to be here today and actually share with you, team, the experience and about the Outsourced Resource Center. Can you, next slide, please? So the Outsourced Resource Center is quite an innovative approach. Why? Because it's an outsourced resource center that is funded by Bill and Melinda Gates, and it tends to actually give support to technical partners to help them implement and contribute to stronger public health supply chains. The OTRC, which stands for Outsourced Resource Center, and please I'll be mentioning the OTRC several times in the presentation, it means the Outsourced Resource Center, will act as a catalyst to increase the skills of technical partner and governments that are willing to implement the outsourcing. How are we going to implement this support? The support is implemented in terms of tools, coaching, training, and assessments and evaluations. What you are not going to do is to target existing business in countries that are supposed to be done by a technical partner. We are not willing to have offices in all countries that are going to be interested in our services. Instead, we are willing to actually develop the capacity of technical partner that is already operating in that particular country. Next slide, please. So the Outsourced Resource Center, as I was saying, it will build the capacity of technical partners and governments. And it will also, that there will be situations where the governments will request the support directly. Why? Because we might not have technical partner that is supporting in the supply chain field. As we all know, most of the technical partners are clinical partners. So we are aware about that. So we say in those situations, we're going to give direct support to the government. We are also supporting the 3PL and 4PL market development to ensure that the current markets of transporters is developed enough to respond to the government Ministry of Health needs to transport outsource health commodity transportation. So we expect that the partners and governments will be directly contracting and working directly with the 4PLs and 3PLs. What the OTRC will do is giving support to the implementation, which means giving support to the entire team of stakeholders that are in the outsourcing implementation. So we expect that the technical partners or governments that are going to implement outsourcing in their countries are going to be able to fund the transportation and contract direct with transporters and 4PLs and any service provider at that particular geographic location. Selena, can you go to the next slide, please? So this slide here lays out the experience that the OTRC gained throughout the years. As Scott was saying, it takes time to be accepted and implemented. And here it shows that we started back in 2014, 13 with advocacy, and then 2015 we started with the first distribution in Tet province. And after 6 months of implementation, we had an external entity coming and audit and actually make a report on the implementation, and we had quite a good result. Just to give you an example, out of stock index on ARV reduced from 37% when we did the baseline, and after 6 months we were in 7% of out of stock due to regular distributions and regular visits to health facilities. So we started this process with Vital Foundation in 2015. It's an English foundation. Then in 2016, proven the success in Tet province, USAID gave us funding to expand it, to scale it to other province in Zambezia province. That was the second province. So one very important thing I must mention here is that in Tet province, we started with one 3PL. We had directly contract with the 3PL. And as we see that the model has been accepted and it was going to scale, we came up with the idea of introducing a 4PL model, whereby the 4PL now contracts several transporters to do the transportation of health commodities. After implementation in Zambezia, 2 years after, we scale up to another 2 provinces, and we also hired another 4PL to make it 2 4PLs and make it more competitive. In 2021, we scale up to another 6 provinces, making it 90% of the entire country. And then we also integrated vaccines into the supply chain. And in 2021, when we handed over to Shigar mechanism, which is direct contract from USA to a 4PL, we were in 1,440 health facilities covered by the outsourcing. Now I'm going to hand over to Eselina, who will explain what are the services that the outsource really does. Over to you, Eselina. Thank you.
Thank you, Alvaro. So after understanding the OTRC, how they gained the experience, we will describe here what are the Outsourced Transport Resource Center service that are the systematic way how this resource center will provide support to the partner or government interested. So we have advocacy that actually is what we are doing now, that is explaining, socializing, and promoting this outsourced transport model. And but also this advocacy service is related of the government education and describing what are the prerequisites for outsourcing. And as the outsource is related with the private sector, also the private sector participation development. Then we have the strategy and planning service that is a crucial service because it's the moment where the resource center collaborate with the stakeholders involved to implement this process, the partner, the government, and private sector, to ensure all are collaborating and understand all the procedure to implement this model. So also the assessment of the transport market capability and social impact will be done. And the government outsourcing strategy, the government's needs, service needs to implement the model, and the plan, implementation plan will be executed during this moment. Then we have the implementation support that is actually doing, the resource center will actually provide the support to do the outsourced transport, and the government and transporter capacity development will be provided. And the 4PL and 3PL contract, the service level agreements, and the transport costing and cost management will be all integrated in this moment, and the support will be provided. And final, but we have transition to the government that is part of the process. When the transition to government is the support from resource centers provided directly to the government, this transition happens naturally because it's integrated already in all the service, as the government is in the drive seat of all this process. But also the government, in the end, they knows they need to own this this implementation, and they need to already be prepared in the future. When the resource center provide the support through a technical partner, this the model will be a little bit different, and the transition strategy, transition readiness assessment, and transition plan support will be provided. So, and when we go to the next slide, we will understand that when the technical partner is part of this implementation, the technical assistance partner capabilities needs to support the transport outsourcing in the public health supply chain is needed. So we have 5 capability areas, and to ensure that we have successfully integration of the private sector and the public health supply chain. We know that those technical partners, they already have capability. The resource center will only the resource center will fill the gaps, the capability gaps, to ensure the quality assistance from this partner to the government. So the first area we have is the public health supply chain, where the attribute is related to this partner, be a trusted partner in this public health system in the country. They need to have experience in the implementation project in the country, collaborate with other partners, but also needs to understand what are the issues of transportation in this country that will support in the assessment process. Then the second one, we have the private sector engagement. So this area is related to how this partner is valuable in the local transport industry, as we are talking about outsourcing. And this partner need to have experience and capability to develop and maintain collaborative agreements between the government and the private sector. And third, we have the transportation expertise that is related with the KPIs, the performance management, understanding the key transport data, all the cost elements that are involved in the performance framework, to allow to identify what are the gaps, what are the things we need to improve and successfully achieve the object. And then we have the business strategy and financial mode, where the partner understand the transporter business strategy, transportation operation, and the financial mode. And final transition to the government. This partner, as we already said, need to have the capability to develop the transition strategy, the transition plan, and have a knowledge of using the toolkits. So those are the technical partner capability needed. And when we go to the next slide, we will describe here how can everyone can engage with this resource center. So first, the government needs to express interest. Even if the support is through a technical partner, the government needs to express interest. And then the resource center with the other stakeholders will evaluate the opportunity. That is the moment where will be defined how the objective of the government will be achieved to implement the outsourced transport. After this, be all agreed, there is the agreement moment, the agree to collaborate, where we sign the agreements, and the roles and responsibility of each part, government, partner, resource center are described. And then the assess the capacity needs is provided, that actually is elaborating the work plan and approve the work plan. And in all this moment, the collaboration is integrated with all the stakeholders. Finally, we have providing support. The OTRC provide the support to the government or by a technical partner, and through the coaching, the trainings, the toolkits are available. After the support, there is assessment impact that need to be done to ensure that after the resource center support, the partner or the government will continue the outsourced transportation without issues, and will ensure always improvement of the process. And please, can we go to the next slide? So the resource center understand that the countries will be at different starting points regarding the outsource. So the OTRC support can be injected in at any phases. We have explore phase, where the country wants to understand the benefits of outsourcing. We have the plan and implementing phase, where the countries are starting plan the outsource model, or want to strengthen the model implement. Then we have optimize, where the countries want to improve some KPIs, example, deliver, quality, or cost. And finally, we have transition, where the government ownership wants to ownership all the management of the outsourced transport. So in the next slide, we resume it. What are the typical situations which might trigger a need for the OTRC? And here is the chance where everyone can invite others to engage with this resource center. So according to the entry points we described it before, in the explore and plan phase, we are talking about situation where the government or partner describe transportation isn't working well, or wants to have other options before they may have major investments in vehicles and maintenance, or in the minister, in the government, a part of the collaborates agree with outsource and others don't agree with outsource. And then we have the implement. In the implement starting points, normally we will identify situation where those countries want to improve how they collaborate with the private sector. So the resource center, there will be an option. It will be an alternate a way to engage, to understand how this can work. And we go to optimize, where the country already implemented the outsource and they want to decide some needs to improve what they already done. And they want to improve their performance of specific KPIs. And finally, we have transition, where the government assumes that they want to ownership all the management of the outsourced transport resource center. So thank you, everyone. I will hand over to Alvaro now.
Thank you, Selena. And thank you, the participants. And thank you, IHPL, for this opportunity. As a conclusion, I'd like to say that, sorry, let me just turn on my camera. So I'd like to say that we would like to get support from all the participants to spread the word. Actually, when you feel that there is much negativity into the supply chain area, it's a good time to introduce the OTRC. The OTRC is available, it's funded, already paid. So if it's not used, it will still be there. But if it's used, it's better because we can improve the supply chain performance in the health area in Africa, Sub-Saharan Africa. And as I would like also to mention at this time that we have planned a survey, a perception survey that is going to be on air in the next month, where we will invite some of you probably to support in responding it. So we have a good understanding of what's the level of perception in African countries in terms of outsourcing. Also, the Outsourced Resource Center publicizes every quarter one technical note. Right now, we have 2 already publicized. You can get them in the LinkedIn and on VillageReach website. I must also emphasize that the OTRC, it's not meant to be a VillageReach only driven thing, but instead we expect other organizations to join us and add other capacity and capability areas where we can all support governments to embark into outsourcing for health commodities. By that level, I would say thank you very much. Handing over to the team. Thanks. Bye-bye.
Thank you, Alvaro, and thank all the panelists for a great presentation. I don't see a lot of questions in the Q&A, but I do have some questions of my own. So I'm going to take my moderator advantage and ask them. So let's start with Scott for the Global Fund. Is the Global Fund providing funding support for ministries to outsource? Scott?
It is, yeah. Thank you for the question, Walter. It's not a significant amount, I would say. I think we're just starting to see interest in outsourcing. And so in terms of next steps, I think we'll see that in our next funding cycle, which will begin next year. We expect to see more activity around outsourcing, but it is certainly an activity that we support governments in their outsourcing efforts and want to provide technical assistance that matches the needs. And I think part of what we do now, and a lot of what I spend my time on, is helping to understand all the technical work that goes into outsourcing, from understanding your current operation, your current needs, to assessing the market, creating an RFP, and then managing that contract. That requires a unique or specific type of technical assistance, different than what we've provided in the past, which was focused on warehousing and distribution when it was done internally. And so we need to make a shift in terms of the technical support that we provide to countries as they go down this path. And it's great to see with VillageReach providing some of that technical assistance, because it's very much needed.
Thank you. And then I have a question, I think, for Alvaro. Sort of something you mentioned about capacity building for 3PLs. I think Esselina also talked about it. And I think there was a mention that you reach out to provide the capacity building to 3PLs and 4PLs. Are you also reaching out to 3PLs and 4PLs that are not already engaged with the government? I don't know which one of you want to answer.
I can take that one. In the countries that we are going to give support outside Mozambique, we will not deal directly with the 4PL in terms of contracting, but we will give technical support both to government and 3PLs and 4PLs to work together to have a common understanding of the key performance indicators. We'll support them in service level agreement signing. We will support them in the whole process of bidding and RFP. We all have that knowledge that will be given to those entities. But in the Mozambique side, we are going to go further and actually support the 3PL market and 4PL market to ensure that in few years from now, we don't have only multinationals bidding for a 4PL service, but having also local 4PLs enough developed to be able to bid for the next phase of outsourcing of how commodities. Over.
Okay, thank you. Yeah, my experience with the USAID Deliver project in India was that we helped the government sort of find 3PLs and 4PLs, and then try to see what their capacity was to actually, fulfill a contract. One of our issues was that it was sometimes hard, also in the Philippines, to find companies that could go nationwide. I don't know if you've experienced that or is that in Mozambique, but you may have several different 3PLs. I don't know if that's been your experience as well.
Exactly, Walter. I think it's similar in many African markets. We do have some strong 4PLs or 3PLs, but their geographical cover might not suit the need of the Ministry of Health. But that's why the OTRC will play in that field to build up the capacity of these 4PLs and 3PLs, because we realize in our experience that most of these 4PLs, what they need is support in terms of tools, technology, so they can actually go to the next step and have the capabilities to work with governments in outsourced transportation. Over.
Okay, great. Let's see, I see some questions here in the Q&A. Well, one is a statement from Beatrice Banda. We appreciate Global Fund efforts in offering support in procurement of family commodities and TB drugs. They should also help their funding model to include transportation cost. So Scott, do you want to, I think you do help with transportation, but maybe you should answer this.
Well, yeah, and I should just add that, so I sit within the supply chain team and we provide technical assistance and support for supply chains in country. And so we are a resource for the country teams in the Global Fund. So the country teams really also driven by the country coordinating mechanisms, design the projects. And so how funding is allocated is something outside my scope, but from my understanding, typically those are requests that come from the CCM and then the budget is put together. So as you said, Walter, yes, in many countries we pay for transportation costs. So I'm not sure exactly in this particular instance what the dynamic is, but that is absolutely part of some of the projects.
Beatrice, did you want, oh, okay. So we have another one, is great presentation, congrats. Have timelines been defined to reach countries for short and medium term in terms of number of countries? I think this is with Alvaro and Eselina in terms of your center.
So yes, yes, please. So regarding the countries for this year, we would like to achieve at least 2. It will be 3 with Mozambique that we are already here. And until the end of 2024, the total will be 5 countries with those 3 that we described.
Okay.
Okay. Thank you.
And then we have another question in terms of, it's interesting. We have already thought about including warehouse in the OTRC, or is this for the long term? I'm not quite sure whether what is the long-term support, I guess, that you would provide? I don't know if that's the question.
Thank you for that question. In terms of long-term support, as Eselina mentioned, all our solutions are embedded the transition process from the beginning. We don't expect to be a long-term supporter for any of the implementation, but we expect that we are going to come there, equip the teams with the necessary and needed tools to implement successfully the outsourcing on the ground. And we can then have a follow-up virtually, but not as intense as it will be in the beginning, because we expect to take those resources to other new countries that are willing to embark into outsourcing. So responding directly, it will be, we don't expect to have a long-term relationship, but presential long-term relationship, but mostly a virtual relationship as a follow-up for long-term, but a short-term, we expect that the teams on the ground actually own it and implement it once the outsourcing support is over. And just to take a chance, I would like to just mention that we have 2 surprises in the panelists, in the attendees. We have Dirk. Dirk was the consultant who came in TED 6 months after implementation to do the study, and he's here participating. He's a big surprise. We also have Asani Raul. Asani Raul was the chief of provincial depot who, when we started all this implementation in TED, so both of them are actually from the bone of this outsourcing in Mozambique. They are parts of this, and they are all here with us. Happy to have them. Thank you.
Okay, well, it turns out that Dirk has actually put a statement in question in the queue in the chat line. So in Sierra Leone, we have outsourced distribution providers who over time seem to have built a monopoly and became very expensive. We did an in-source pilot project which showed massive possible savings. Or does the Resource Center have a mechanism to help governments and train them on how to evaluate fair pricing?
Thank you, Dirk. From you, we really expect a difficult question. Okay, so yeah, cost is a very sensitive piece of information that really requires a very sharp eye. So what we have is that we build up a costing structure that we build the capacity of government folks to actually measure those costs and be able to evaluate. So we have identified a few indicators, which is cost per kilometer, cost per volume, and cost per site, and cost per dose, for instance. So those indicators are the indicators that we measure them systematically on a monthly basis, and we do have structure to build the capacity of government to be able to analyze those costs. Unfortunately, to say that if that's the fair cost that is being practiced in each country, it will be difficult because each country varies from geography, political, social, all those aspects are related to that. But yes, what we have, it's a real, very well structured cost-driven process that will first educate both government and the 4PL to be able to understand and share those costs to better come up with solutions to improve cost. Over.
Thank you, Alvaro. So Esselina, I have a question for you, is because you mentioned the toolkit. I think both of you did. Can you elaborate a little bit more what's in your toolkit that you offer?
Yes, with this moment where we implemented in Mozambique and with all this partnership, government and the private sector, we identified that there is a need to create a toolkit, online toolkit available to allow to the promotion, socialization of all the SOPs, all the mechanisms, all the strategies created to the government, but also for the 4PL, and be available in the online toolkit. So for now, we have the Trello toolkit available, and all the sources that was developed is available there, and the government and all stakeholders have access to it. And I think this is a very important and relevant aspect that can be a shared learning to the other countries where we're going to implement it. But also we have we are supporting with an agreement we have with Africa Resource Center, and they created the OSTK, the Outsourced Toolkit, and we are providing support to the government to identify in this toolkit the relevant aspects and implement it in locally. How can use this toolkit. Over. Alvaro, do you want to add something, please?
Oh yeah, maybe just say that the toolkit is part of the transition process, whereby if you want to transition any knowledge or any solution, you need to have a toolkit whereby everyone can go and access and have all the information they need, instead of relying only on Esselina or Alvaro or someone else who have experience. So all our knowledge, all the tools that we co-developed with the government, we tested, we refined it, we implemented it. All of them are kept in a place where in an application called Trello, where everyone can have access to download and actually adapt it to your own context and use it. So that's available, and it's ready to be used. The government of Mozambique also is aware, and they also benefit of it. Thanks.
Okay, thank you. Oh, we have another Q&A question that popped up. It's from Beatrice Bend. Can we have access to the toolkit?
Oh yes, we can give access to the toolkit as soon as we have. We will share the emails here. They just need to send an email requesting, so we can use their email to invite them to the link. Over.
Okay, and they would send the request to whom?
To me or to Selena, any one of us, that should be okay.
Okay, and your email addresses are on the page.
The screen, yeah.
Yes. Okay. All right. Well, I want to thank the panelists for a very interesting presentation and something that is very important and also part of the wave of the future for, I think, public health supply chain. And then I would be amiss if I didn't say for all of you that, of course, you can join and be a member of IPHL. It is free. It's easy to join. You just go to the website, you click join, and you fill out a little survey about who you are, and you become a member and have access to the comments and stuff from our 8,000 members in 152 countries worldwide. Okay, thank you. And then I think is the last, what's the next one? Yes. So again, thank you all. And thanks Scott, Alvaro, and Esalina from the Global Fund and VillageReach for this. And again, this has been recorded and will be on our website. And we also put it out on YouTube. So thank you again, and enjoy your morning or your afternoon or your evening. Bye, everyone.
Thank you. Thank you all.
Take care. Thank you.
Bye.
Thanks. Bye-bye.